Okay, Lachman's test. Let's start with the Lachman's test. That'll help us to test for the integrity of the ACL. We will grasp the individual's leg like this so we can control this distal part of the limb. I'm going to grasp around here with about 20 degrees of flexion in the knee, stabilize here, and I'm going to do is distract and bring my hand up towards the ceiling to see if I can displace the tibia anteriorly. Positive sign, greater than 5 millimeters worth of anterior displacement of tibia on femur and or pain. Next one would be a Ferris test. You have the individual in the same grasp as I used for a Lachman's if I want to. I'm going to then grab a hold of the leg across the medial joint line and stabilize approximately. Bend him to about 20 degrees of flexion and apply a force outward this way with this hand to stress the lateral structures. It's a Ferris test, testing the integrity of the lateral collateral ligament. All I have to do is switch my hand placement, and now I put my hand over the lateral joint line, 20 degrees of flexion, and I push interiorly towards the medial side to stress the medial collateral ligament. Okay, positive sign, greater than 5 millimeters worth of displacement, usually, or excessive laxity, pain. You can then put him into this position. I'm going to stabilize his foot. He's about 90 degrees of flexion of the knee. This is an anterior drawer test, which will test for the integrity of the ACL, once again. Put my thumbs on the medial and lateral tibial condyles. Lace my fingers behind and pull forward until I take up all the slack in the tissue and pull. The intent is to try and displace the tibia anteriorly. Positive sign is greater than 5 millimeters worth of displacement and or pain of the tibia on the femur, indicating a lax ACL. PCL, same position as the anterior drawer, and I just push backwards. Greater than 5 millimeters of displacement posteriorly indicates a posterior cruciate ligament injury. Grind test. Put a little something underneath the knee. This is the test for chondromalacia patella or injury to the backside of the kneecap. I milk backwards like this a little bit and then come forward so that in the web space I've captured the superior portion of his patella. I then press into the tissue and ask him to activate his quadriceps. So I want you to push down into there, and he gets a very positive sign there. It's painful and there's a little stutter, and he doesn't come superiorly. What happens is the patella comes up and is driven down against the anterior portion of the femur, giving us our positive sign of pain or inability to activate the quadriceps. Okay. Apley's test. The individual lies on their stomach. I did a grind. Yeah, this is another way to do grind, just medial and lateral like this. Okay. Apley's test tests for the integrity of the meniscus. Have the individual lying supine, prone, right? Let's get those mixed up. So he's prone on his stomach like that. I bring him to 90 degrees of flexion of the knee. I'm going to grasp around the malleoli with one hand. My other hand is across right through the calcaneus. I then apply a downward force, pushing the meniscus into the femur, and then rotate medially and laterally using both hands. Positive sign is pain, clicking, popping, or catching as I rotate with that downward force, indicating meniscal tear. Okay?